Okay, so with this, the uric acid, everybody knows about gout, and we think that it's nothing, it's just a joint disease, it has no problems. You need to know that people who have gout have a chance to develop cardiovascular disease, has a chance to develop kidney failures, and they die sooner. So gout and uric acid is no longer just a minor thing. When we talk about uric acid, in the past, even right now, it's not part of the checkup programs. So when you go to the regular, cheap or whatever checkup programs, you will not know your uric acid level unless you ask for. You're lucky if you are women, because women tend to have lower uric acid level. So in women, you're not supposed to have higher than 6 mg/cent, but in men, we allow you to have about 7. The fact is, if your uric acid level is above 7, it will precipitate and cause problems. And if you drink acidic food, for example, soft drink, diet or not diet, pH is only 2.5, I will show you, you will have another problem because the uric acid, even though it's not as high as 7, it will precipitate easier. When we talk about uric acid, we think about purine. Purine is making uric acid. But what we don't realize is, when we talk about hyperuricemia, you always say, oh, don't eat chicken, don't eat duck. Even you are vegetarian, you can have hyperuricemia because 1/3 of the uric acid in our body, we make it. We make uric acid, we call de novo synthesis. So we can make uric acid from ATP, AMP. We can make uric acid if you stimulate it with alcohol. So everything can make uric acid. And because if you have a kidney problems, it's not like a renal failure or anything, but you have a genetic problems that you cannot get rid of uric acid, you will have hyperuricemia. In Thailand, we don't know incidence of hyperuricemia, but I estimate it's about unbelievable. In men, should be as high as 20%. I used to do other studies. So what is the cause? Part of it is genetics and sex. So men has a higher chance of have hyperuricemia than women. And in Asian people, we tend to have a hyperuricemia. Drugs. I hate diuretic. Many doctors use diuretic to treat hypertension. It's true, it's in the guidelines, but actually guide to do what? Guidelines should be written based on the patient's sake, not somebody else.